Hi, my name is Rebecca Barry and I'm the supervising pharmacist in Lloyds Pharmacy in Castletroy in Limerick. Here at Lloyds Pharmacy, our colleagues are ready to help you through all the stages of menopause. The three main symptoms that ladies would present with for needing help with would be hot flushes and flashes, vaginal dryness and atrophy, and emotional disturbance and difficulty sleeping. We've a wealth of products that can help you through all of these issues, and I'm going to run through these and explain the ways that we can help you with your symptoms. So hot flushes and hot flashes, what are they and how do they differ? A hot flash is an intense feeling of heat, very often in the upper body. Hot flush is a hot flash with the facial redness and often spreading down onto the neck. A lot of ladies will experience a lot of sweating along with those symptoms as well. When this happens at night time, the intense sweating and waking up in a ball of sweat can very often disturb sleep and just lead to more debilitating symptoms of emotional unwellness from lack of sleep. So how can we help you through this and what products can be taken? So one of my go-to products would be Clean Marine Menomin, and it's got a nice balance of different ingredients to help you through these type of symptoms. One of the products in it is a soya extract, and soya has estrogen-like activity in the body. So for anybody who's not on HRT already, we can recommend this type of product to help with the hot flushes. They'll help improve the symptoms. As with HRT, my advice would be give it about 3 months. If you're not noticing any improvement, then we can move on to either using something else to support it as well, or possibly moving on to a different product entirely. In Lloyds Pharmacy, we have a range of different products that have different ingredients that can help you with your hot flush symptoms. The different products will differ in what they have, from evening primrose oil to a herb called black cohosh. We've already mentioned soya extract that has estrogen-like activity, vitamin E oil, and we can tailor our selection to your set of symptoms. So at Lloyds Pharmacy, we always like to not just give advice on products, but also to give advice on lifestyle measures as to how you can improve your symptoms. And there's lots of different ways you can help yourself to reduce hot flush symptoms. So one of the ways being to dress in layers so that you can peel off layers as you feel the hot flush starting. Try and keep your rooms in the house as cool as possible, particularly your bedroom at night. This might mean also reducing down, say, the TOG rating of your duvet. Other ways we can reduce it are by avoiding hot, spicy foods. Caffeine can also exacerbate hot flush symptoms, so reducing your caffeine intake. Limiting alcohol, because alcohol can also make symptoms of hot flushes worse and can increase the rate that we feel hot flushes. Exercising regularly has been shown to reduce the severity and the number of hot flushes we experience as well. Now is also a good time to quit smoking. Smoking has been shown to increase hot flushes, and quitting smoking also has the nice side effect of protecting your heart when it's already going to be at that stage of being at slightly increased risk of cardiac problems. So the very cardioprotective function of quitting smoking is a welcome side effect of that. So one of the less talked about symptoms of menopause is vaginal dryness and atrophy. And this can cause a range of symptoms from lack of sex drive, pain during sex, urinary frequency, repeated urinary tract infections, and really is something that we should be getting on top of and treating. And in Lloyds Pharmacy, we have a whole range of products to help you with these symptoms. Some of the soya-based extracts in some of the menopause supplements will help with these symptoms, but we also have a range of topical products to use, many of which can be used in conjunction with any HRT-based topical treatment for vaginal dryness. So we have vaginal moisturizers and vaginal lubricants, and these are two totally different products. So where do they differ? Vaginal lubricants are very short in duration of action, and they're really designed for easing discomfort during sexual intercourse. Vaginal moisturisers are much longer acting, and they can be applied anything from every day to some products only being needed to be used twice per week, for example. They can also be used in conjunction with each other for optimal comfort, so using a vaginal moisturiser on a regular basis, and also then using a vaginal lubricant during sex. So how do we use these products? The vaginal moisturisers often come with applicators. Two that I like are the Vagisil Pro Hydrate and the Multigyne Liquid Gel, both of which come with applicators. So you'll fill the applicator and insert the applicator and then the contents into the vagina. If you have a lot of vaginal atrophy and dryness and any insertion is painful or difficult, it's always an option to use a water-based lubricant, such as one that I like being Optilube, and applying that to the outside of the applicator, and it just eases the insertion of it. And finally, just to mention that if you're using any of these intravaginal products and your symptoms worsen, or you have any unusual symptoms, discontinue using the product and consult your doctor. So one of the very common symptoms that in Lloyds Pharmacy we get asked for advice on how to help ladies during the menopause is the range of symptoms from anxiety, emotional disturbance, and difficulty sleeping being a huge part of this. And of course, if we're not getting a proper night's sleep, it's just going to worsen our symptoms of anxiety and emotional distress. So in Lloyds, we have a whole range of products that can work in various different ways to help you through these symptoms. Some of the broader encompassing products for menopause will include some of these in it. And we also have other products for helping to support a good night's sleep that can be taken along with the more traditional nutritional based menopausal supplements as well. So what I'd say is speak to your pharmacist or the Lloyds Pharmacy colleague about your range of symptoms and which ones you really want to address most pressingly. So what's in these products to help? So we have herbal products like valerian and hops complexes, various different types of those, which have traditionally been used for hundreds of years to help support a good night's sleep. We also have nutritional supplements containing things such as L-theanine, which is an amino acid, lemon balm, which are all going to help with both anxiety, emotional distress, and sleep as well. We also have a product called Zenflor, which contains a probiotic, an acidophilus supplement that has been shown in clinical trials to also help sleep in people who are experiencing anxiety, distress, and sleep disorders. Magnesium is another supplement, which is one that I love recommending for help with anxiety, stress, and especially sleep problems as well. It's been shown that lack of magnesium in the body is hugely linked in multiple different studies to difficulty sleeping. And one of the products that I particularly love recommending for this is a product called Mag 365. It's a very easily absorbed magnesium and is recommended by me frequently to customers who come back and say they have had great improvement with their symptoms with it. So the very best of luck to you all with your journey through your menopause. If you want any more advice on any of the products, or indeed any other products that can help you with your symptoms, pop into any of our Lloyds pharmacies where our colleagues will be happy to help you and give you advice on our product range. Or indeed you can visit lloydspharmacy.ie for even more information.